I think it's a very big problem. Most people don't take their medication all the time. It's especially hard to take medication when you're taking it for an illness to prevent the onset of the illness or recurrence of the illness. And so I think adherence is one of the biggest problems that we have in all of medicine. I think the majority of patients are non-adherent. There's about 4 people that take all their medicine all the time, and then there are people on the other side who will tell you, I'm not going to take any of the medicine that you give me. But the majority of patients are somewhere in the middle. They take some of the medication some of the time. So it's always a problem. It's always something we have to be aware of. Partial adherence is the biggest problem. It's the majority of patients who take some of the medicine some of the time. And so we really need to pay attention to how much medication they're taking. You know, what is a therapeutic dose of medication is left open to some debate, but people should be taking at least 80% of their medication. And if they're not, then you may have a problem with efficacy, and you really need to address it. Well, there's plenty of data that show that if people don't take their medication, they're much more likely to be hospitalized. If people are constantly in a state of clinical instability, they're not able to focus on their recovery goals, they're less able to work, they can't go back to school. And so it's very important that you have good medication adherence to be the foundation for working toward recovery. It's very difficult to measure adherence. The very best way to measure adherence is to use injectable medication, because then I know if my patient doesn't come for the shot, then they haven't taken their medicine. But for people on oral medications, it's very difficult to know how much medication they're taking. You can do blood levels, but that doesn't really tell you very much. It mostly tells you about the adherence behavior in the last 2 days or 3 days, and you can only tell if people are taking some medication, but you don't know how much. And then electronic monitoring is very cumbersome. It's not really used in a clinical setting very often. You have counting pills, but it's very difficult to count pills as well, because many patients have many bottles of pills, and you don't know what bottle they're taking their medicine out of that week or that day. So it's very complicated to assess adherence unless people are coming in for an injection. Then if they don't show up, you know right away, and you can do something immediately to address the problem. My experience with long-acting injections has been very, very positive. For example, we work with patients who have been hospitalized many times. So in the past month, they may have been hospitalized 10 to 15 times. And our job is to go out and find out why they continue to relapse. And one of the things we do as we're working with patients in their home is we go to the doctor with them and we suggest maybe we should use a long-acting injection, because they're having a lot of trouble in their home taking medication. And what we see with these patients is that once the medication is consistent and they're getting their injections regularly, you see them suddenly be able to work on their functioning in the community. They can maybe get volunteer work, or we have one woman, for example, who wanted to get back visitation with her child, and she's able to work on things that make her life better now that medication is taken care of. Yes, with first onset patients, it's very important that they adhere to medication. They have a 5 times greater risk of relapse and rehospitalization when they stop taking medication than when they continue medication. So I always recommend trying the injection, because you know if the medicine's on board, you know when the person stops. You can discuss why they stopped and what they want to do about adherence. So it makes sure that the conversation happens. If you send people home with pills and you don't know when they stop, you might not have that conversation. So it's very important, and we often use injectable medication in first episode patients. What I would say is that almost everybody that I talk to, after 2 or 3 interviews, I can kind of get them to agree to try an injection for several months to as an experiment to see how they like it, how it will work for them. I can almost always get someone to agree. I think that initially, almost everybody says no. Nobody wants to get a shot. But when you weigh the minimal pain for a brief period of time against having a long-standing, chronic, very severe mental illness, people can see the value of taking an injection. So you spend some time with patients over the course of 2 or 3 meetings, and eventually, if they trust you and they agree with your judgment, they'll try it. Well, the caretaker, always wants to make sure the patient's taking the medicine, and it often causes a lot of friction in a family if the mother is asking the son, for example, have you taken your medicine today, or did you take your medicine? It causes a lot of trouble. If people are getting the shot, you don't have to deal with that anymore. So the family is much calmer. The patient can now work on functional outcome, things like getting a job, or things like going to volunteer work, or maybe taking a class at school. They don't have to focus always on taking medication. And so for the family, it's a big relief to know that the medication is on board. The recommendations that we made are that, many patients, nearly every patient, should be offered the opportunity to be on an injection because it's a different way to manage their illness that may be more convenient for them, that may offer them more consistent medication, and that alerts everybody to when they stop taking medication, which is really important. So we recommend that people consider the use of injectable antipsychotics much more often than they do. So that's one issue, that people assess adherence regularly, because it's not something that is consistent. So you might have a person who takes their medication very well at one time and not at another time. So it's very important to keep that in mind, that it fluctuates. So to constantly assess adherence, and to include, whenever possible, the family members of the patient in the interviews to get information, and to really talk to patients about what they like and what they don't like, and very much to tie the taking of medication to reaching the patient's goals.